and thank you for joining us for today's webinar using your data extraction tool to help finalise your stage 1. So today, as you're all aware, that this webinar is in 2 sections. We're going to have Matthias Merzenich from PenCAT speak to us for about 10 minutes with a few minutes for Q&A, followed by POLAR representative Shane Lowe, who will also speak for about 10 minutes, and both of them will show you their the tools that they've developed to help you with your COVID-19 vaccination programs. And then depending on how we're all going, I would really like to throw the mics open at the end for maybe 5 or 10 minutes if we've got it, and discuss with everybody what they're going to do, where the obstacles are. I guess I've been on this journey now for about 6 weeks with some practices, and it's interesting some of the misconceptions about what's possible, what's not possible. So it'd be really interesting to hear your ideas on how you're going to go forward and share that with all of us. All right, so without any further ado, I will stop sharing my screen and hand over to Matthias. Thanks, Matthias.
Yeah, thank you, David. Well, I'm ready to share my screen. All right. Yeah, so thanks everyone for joining, and I've got just 2 slides, and then we'll get into some practical examples of actually how our tool works, or what you can do with it in the context of COVID-19. Just as a quick reminder, high risk and moderate risk. So the age is obviously there, older than 70. And as you know, there's now the rollout is 50 older, and I think Queensland has started at 40 now, but that's a sort of different story. But the high risk and moderate risk is what I wanted to focus on. People with organ transplant, bone marrow transplant, immune suppressive therapy, blood cancers like leukemia and so on. And then the moderate risk in here. Just a note at the bottom here, some chronic inflammatory conditions and treatments, we couldn't map that because it was just not specific enough, the information. And poorly controlled blood pressure is another one, because that is not something that is diagnosed as such. It is something that is happens based on the results and so on. So that is not included. If you have patients that you know that have poorly controlled blood pressure, for example, they won't be covered by our report. You hopefully know who they are, and you can pull them up with other means. Just a quick note there, we have our user guides on the help site, so all of the things I show you are explained in detail there. And there is a newsletter sign up there, and of course our help desk line. So that's it for the theory. Let's have a look at the practice. So you can see I've already opened my clinical audit tool. I have the data loaded. I've gone to the immunizations tab, as you would expect for any vaccines. And you can see there's a tab here that's called COVID-19. And that's, of course, the one that we're going to look at today. So this covers the whole population. So this is everyone in my practice, 12,442 people. And you can see there are 315 people who have received the first dose and 4 people on dose 2. And you can see the legend here on the side. So dose 2 is green, but there's just so few there. I can just see a very thin green line there. We do have an option for declined. Now, at the moment, only medical director allows you to record that a patient declined a vaccine. For those of you who are using medical director, that will bring up the patients that have declined. And mind you, every person is on this chart only once. So if they receive the second dose, they will move from first dose to the second. If they declined but changed their mind and received dose 1, they will move into that area. So you cannot be in more than one of these categories more than once. And lastly, of course, the not recorded. So this is at the moment still, I can switch to percentage, 97.5% roughly of the patients have nothing recorded. So that's just everyone. So the more interesting one in the context of today of the at risk, the 1B rollout, we have the groups here. So there's high risk at the left and moderate risk on the right. You can see the numbers in there. If I double click on the on those 1,812 people there, you can see, of course, they're all not recorded. They're all in the high risk group. And you can see in the description, why are they actually here? When your cursor turns to the little hand here, there is actually a way to sort this. And you can see that there is someone with that blood cancer that I mentioned before. So they have a myeloid leukemia. The vast majority of people in here are there because of their age. There's some other transplants, you know, multiple myeloma again, and so on. But that's based on the mapping that I mentioned before. More of interest maybe today is the how you check people that have received the first dose and what's going on with them. So we have, you can see 235 have in the high risk group, and I can't see 50 in the moderate risk. If you want to look at both of them, you just click on the legend on the dose 1, and you can also double click on here. Same thing as on the chart, but in this, now we're getting moderate and high risk dose 1. So again, it will tell you here the details of the vaccine. So they all are on dose 1, we know that, and which vaccine received and what date, if they're in the high risk or moderate risk group, and again, why. So if I sort it by this here, you can see there are some people that have received the Pfizer vaccine. Now, when we designed this report, firstly, there was never talk about Pfizer being given at the GPs, which may change. And, you know, this is obviously was done very under a lot of pressure to roll it out as quickly as possible. So I'm sure there'll be some sort of improvements that we could think about. But basically, in this practice, there are 1, 2, 3, 4 people that had the first Pfizer shot. And then you can see from then on, it's all AstraZeneca below. No one else is there. That's why I sorted it by the dose. So I believe it's 3 weeks between doses. So when you look at the dates when this was given, we already passed 3 weeks, past 3 weeks, past 3, and past 3. So these 4 people here would all be of interest to check in terms of have they you know, had the second dose somewhere else or not at all. So that would be one way to look at that. And you can, of course, look at the AstraZeneca patients as well, at them because it's a 12-week distance there. So either you do what I just did by sorting them by date, but you can also use one of the filters. So that's the date range result filter there. And you can see we got the date range here. My data is from the 10th of May. So to find patients that are due for the second dose of the AstraZeneca, you'd have to go back 12 weeks from the 10th of May and set that as your end date. Yeah, not as your starting date, because if you go 12 weeks back from here, then you get anyone who had received it in the last 12 weeks, but we want people that were outside the last 12 weeks. I've done this before. There is no one there because 12 weeks ago at this practice, no one had received that vaccine. But this will become more relevant over time. And I'll probably put up a recipe on our website to just show you how you can apply these filters. But that would allow you to find anyone with the first shot. What I'll do is I'll show you the same for the Pfizer one. So if I go back 3 weeks from today, yeah, so 1, 2, 3. Is that right? Yes. So anyone who has received vaccine before then, and it doesn't matter how far back I go because it wasn't available for that long, but so this will bring up people that received, in this case, the Pfizer vaccine more than 3 weeks ago. And dose 1 is of interest. And if I show those again by clicking the export, you can see, firstly, there's quite a few people, of course, with AstraZeneca, more than that. But if I sort that again, by going here, so you can see these are my 4 people. Again, we know that because we looked at them, or 3 people, we looked at them before. So these are all more than 3 weeks ago, and the date, of course, confirms that. Yeah, so that's a way to find it. And as more vaccines are rolled out, this will become more useful. Like I said, there'll be a recipe on our website to show you more details. So these are the 2 reports generally covering your population and people at risk. The other thing I wanted to show you, I'm just going to clear my filters, is something a bit different that we haven't done before. And this is under the MBS items. We have a new tab here that's called COVID-19 vaccinations, and it's empty. Why is it empty? Because the MBS item information is stripped from our de-identified data. So I can't actually show you that for our demo data, but this is what it looks like. And this report has caused a couple of questions. For one, it's something new. We've never done anything like that. And secondly, it needs a bit of sort of get your head around how does it work. What we're trying to do there is those 16 items that the government has made available for the COVID vaccine suitability assessment. Yeah, they are items that can be claimed regardless of the outcome. If the patient gets the vaccine or if they don't get the vaccine, the practice can still claim. And that's what we're trying to reflect in here. So dose 1 vaccinated, dose 1 not vaccinated. So these are the people that were assessed for the first dose, but they didn't end up actually getting the vaccine. And we can see this is a made up data, this is not real, but there was 4 number of items claimed, not number of patients. The total population is only 9. And if you add these up, it's more than 9, of course, because people can be in multiple of these charts. So what it purely is about, the main figure is up here. The total revenue is the part of interest there that that was generated out of the COVID suitability assessment MBS items, those 16 items. And a patient could be assessed and be unsuitable for the first shot, but then 2 weeks later they come back and they're assessed again, and this time the outcome is that they get vaccinated. So that's 2 items for that patient, and the same could be repeated for the dose 2. So 1 patient, 2 vaccines could create 2 or more of those MBS items, and it's just something that we thought might be of interest to you as the practice to see this whole vaccination rollout. What does it actually generate in income out of those suitability assessment items? We're very happy to take your feedback on that. If it's useful, if it's confusing, what could be made better? Because as I said, this is a new sort of area we're going in with the income generated. But yeah, basically open for feedback and improvements. And I see I've got 6 seconds to go of my 10 minutes, so I'll stop now for questions, comments, anything. There's my alarm.
Thank you, Matthias. So do we have any questions? I think Bertha asked you to put your hand up in the chat window if anybody had anything they wanted to jump in quickly for Matthias. No? All good. All right. Well then, Shane, are you happy to show us what POLAR can do for you?
Yeah, absolutely. Let me just get this in order. Excellent. I do apologise. Work's just started next door. I'm locked in my house in Victoria, so there might be a little bit of background noise here. Hi, my name is Shane. I'm the education manager here at Outcome Health and dealing with the POLAR tool in terms of delivering the education to practices. So I thank you so much, Matthias, for covering the cohorts. I was hoping not to cover that because of the, the time available. So I will jump past all that, assuming we'll understand who fits into which phase and whatnot. And just quickly want to have a look at specifically identifying patients in that phase 1B cohort and actually breaking down into the individual criterion around that. Looking at filtering on specific age groups. Obviously now we're looking at the 50 plus, the 40 to 49s, and presumably down the track everyone who's under 40, and then looking at those patients who've had a single dose of either of the 2 vaccines and or who are a high risk for priority recall. Now, sorry, my screen sharing is a little bit unusual. Sorry, David, you mentioned that people weren't necessarily aware this report is there. In your POLAR login, there should be an icon that looks like this. We do mark all reports as beta when they first come out, just until we are assured that they're in their final state. So it should look like a syringe or a carrot, whatever you want to look at, that you can use to access your report. So this tool will allow you to work with the data in a few different ways. As I mentioned, looking at if you want to identify anyone who's in the phase 1B cohort, we have a few different ways to do that. We have our patient selector here. So we can see for this practice, they've got about 3,500 patients who fit one of the many criteria around that 1B cohort. Of course, this is based on our interpretation of some fairly broad guidelines given by the Department of Health. I would recommend having a look at the data mapping if you want to know how those cohorts are specifically assessed in POLAR. So we can select our phase 1B patients here, and we can see that our patient count has reduced. If we ever want to export that list, which obviously is the desired outcome, we can click in the patient list in the top right-hand corner. And of course, export to Excel will give us that spreadsheet, which will include things like your patient ID, so you can do a bulk mail out with a third-party tool. So that's simply selecting your phase 1B cohort. If we actually wanted then to drill down on specific subsets of that 1B group, so I'm going to jump across now to my patient phase details screen. Say we have a driver in a specific area, or perhaps some of our patients in a higher risk category. So for example, our patients 70 years of age or older. We can simply click on that selector there, and now you're getting a subset of that 1B phase 1B group. Now we'll say patients can fit into more than one criterion. Of course, there could be someone who's 70 years or older who also has chronic kidney disease. They might appear in more than one of those categories. But that's quite simply how we can do both a phase 1B selection for the tool, but also having a look at those higher risk groups, how we actually can pull those patients out there. So those are cancer patients. As I mentioned before, we can now drill down on the patient age groups. And sorry, this is actually being released today, so it may not be in your practice quite yet, but it will be this afternoon. You can now do the selector for your 50+ age group. So obviously, being that the bulk will be picked up in 2A, there might be in one of those earlier groups of 1A or 1B, but we can certainly select that group. And again, we can have a look at how we're approaching those patients with regards to vaccination. Now we do pick up obviously where they sit with the status of the vaccinations. So down the bottom here on the phase tracking page, we have our group of patients who've got no recorded vaccination. We have a number of patients here with 1 recorded vaccination, and then we have 5 with 2 recorded. And as Matthias correctly pointed out, in medical director practices, some declined patients as well will be coming through. We actually have seen some patients come through with decline from other softwares, but it's a mystery as to how they managed to mark that. So we can pick it up, or I haven't yet identified how they get in there to start with. So we can quickly, if we're looking at remediating patients who've already had at least one of those vaccinations, you can simply select the 1 recorded vaccination button. So at the moment, I'm looking at my 50+ age group. I might even throw in my phase 1B just to drill it down a little further. And then I'm looking at my 459 patients who've already had at least one of those vaccinations. Now that's any COVID-related vaccination. So that could be either Pfizer, AstraZeneca, or a bad piece of data quality, which I will show you. I can go into my patient phase details. And very, very briefly, going to switch to my headphones. I hope that isn't too loud. From here, we can actually then select exactly which type of vaccine we would like to work with. So, for example, here I can see a range of options. So question mark is the one that I was saying was data quality. I will come back to. But here we've got AstraZeneca, a patient who's had the 2nd dose as well of AstraZeneca, declines. Those who haven't had anything, our Pfizer patients, and again, our Pfizer who've had 2 vaccines. We do have 2 more statuses that aren't appearing on here. We've built in just in case they do occur, and hopefully they don't, where a patient has had an AstraZeneca vaccine, then a Pfizer, or the reverse. So you can identify those patients too. Very importantly, this question mark one here is where we're seeing vaccine data coming through where it's non-specific as to what the vaccine is. So in this instance, this patient has had the vaccine COVID-19. So we don't know which one it is. Would be a good data quality initiative to go back and check out the progress notes to see what they actually had. Presumably that part information is in there. You will also see, if I get rid of some of these, talk about bad timing. You will also see a few color-coded items in here. So we've given Pfizer the blue, AstraZeneca the gold the difference between a vaccine marked with a white background versus grey. So this is actually marked as given elsewhere. So it's been recorded in the clinic software, but it wasn't actually given at the practice, it was given elsewhere. I've got information on how you can actually do that again in the data mapping. It's a straightforward process, but of course, having that information in there is quite important to at least know what their status is, even if it didn't get it didn't occur at your practice. Being able to know they've had that first dose is integral. Right here, we can see the patient is overdue. So their second dose was due on the 7th of May. So being Pfizer, this would be the 3-week period. They're past that period now by a good month and a bit. Presumably they've had it elsewhere, or hopefully they've had it elsewhere, but certainly a quick indicator as such. I will actually show one last very quick thing. We have also assessed a due soon. So this is patients who will be due for their second dose of AstraZeneca or Pfizer within the next 7 days to help facilitate a recall process. So just a reminder to say, hey, your 12 weeks are coming up. It's easy to forget 3 months down the track. So, you know, you're due to come back in shortly. So this patient will be due on the 17th. I'm guessing they're all going to be roughly about the same. So we can actually select those patients. Again, going into a patient list, export, and off we go. We've got that information there. I'm glad this is an expert group, because that was a very quick run through of a lot of information in there. But certainly any which way you want to cut this data up, you can certainly do so. And then, you know, sort of see where you're standing across. If I actually get rid of this, little waterfall will show you how you're tracking against your individual phases as well. So fully vaccinated / declined, we can see we've got 9 patients in this practice that have met all the criteria. I feel like I knocked that out, David. I'm happy to. I've got a little bit more I can cover, but I'm very much aware of the fact you wanted to cover questions, and I'm very keen to do so as well.
Yeah, so I guess does anybody want to ask anything or have any thoughts? I guess I'd just like to take this opportunity to congratulate you both. I mean, considering this was something that didn't even exist 18 months ago, I think that both of you have done an amazing job on pulling all this together in, seriously, you know, months of work. It's spectacular. All right, so let's just, so there is still no one on the chat. No one has any questions. Okay, I guess, oh, here we go. Natalie Brown. Oh. Just in the meantime, I guess the one thing that I've kind of been mulling over with a couple of practices is, how do we actually action this? So the first question, I guess, the elephant in the room is, how do I know who's had it done elsewhere? Because presumably I've created a list of, you know, 600, 800 patients. I think one practice said they had 2,500 patients in 1B that were technically missing a vaccine. And how do you go about, what do you do with that information? And I guess the question I'd like to put to anybody who has any thoughts, do you send out a blanket email / letter / text to them going, our records indicate you haven't had a vaccine, let us know if you've had one, let us know if you'd like one, etc., etc. Or do you bother trying to actually cleanse the data beforehand? And the thought being that if they've got a My Health record, I watched it being done in BP the other day. It seems pretty straightforward. I guess the big issue here was privacy. Again, some doctors I've spoken to felt that if you were their regular carer, it wasn't a breach of privacy to go into their My Health record to see if they'd had a vaccine done somewhere else. But other practices might feel differently. And I said, I'd love to hear anyone's thoughts on that too. Bertha, does anyone want to jump in?
I'd love to jump in if I may. Yeah. Being my last job was actually education at the Digital Health Agency. So yeah, look, I guess the My Health record is a fantastic resource Yes, there is obviously the question of privacy, and it's always been a bit of a grey area, but obviously the driver behind My Health Record is that it's accessing data in the interest of providing quality healthcare yes, I can do that, providing quality healthcare to the patient. So I mean, it's not browsing the record, it's actually trying to ascertain information you need in order to be able to provide that care to the patient. So I certainly wouldn't see it as being a privacy breach. Presumably, assuming you are, of course, directly involved in the care of the patient. The primary healthcare provider aspect of it is about the shared health summary upload. You're not doing that. It really is open for anyone who's involved in the care of the patient. So I wouldn't see that as being an issue. Again, not official Digital Health Agency wording, but I'm sure they would be happy to back me up on that one. I guess I would be interested to see how many of those. I'm not sure the workflow on given the immunisation hubs happening at the state level, what the workflow is to get that into the immunisation register, which is the end source for the My Health Record. That's where it gets that information from. So yeah, it would be interesting to find out, but I certainly think it's a great resource to do so.
Yeah, again, I'd love someone who could tell me, is it faster to get the information from the My Health Record, or is it faster to log into AIR? Again, I mean, if I was a nurse or, a receptionist and I was given a list of 200 people to check, it'd be fascinating to know what's the best way of doing it. And the other thing was to find out, is anyone actually going to update their data? Because as someone else said to me, well, would you spend hours and hours and hours checking? Maybe it's actually not worth it. And again, if anyone has any thoughts.
if it's in AIR, it should be in the My Health Record shortly thereafter. So I guess it's a preference on how you wish to access that data. It should be the same. I guess the other thing is as you said, you could do the bulk mail out around. We think we found that you're eligible for this phase. Would you like to let us know if you've otherwise had it elsewhere, and perhaps that is a less labor intensive process, crowdsourcing that information, as it were.
Yep. Sorry, Katrina. So you just made a comment here that it is faster. Which method do you think is faster?
My Health Record. Okay.
My Health Record. Okay. Yeah. Cool.
I mean, I'm, like Shane, I'm not in the business of actually doing this at primary care, but if I imagine that you firstly get an overwhelming list of 1,000 or 2,000 people, and then you have to go manually into each of their My Health Record or AIR, it's not very practical. I think, there could be something from a national level, because we have a national immunization register, that might not be beyond sort of the possibilities that they could create lists of people overdue. But then how does it get to the practice? Which practice would it be sent to? What about privacy? So there's really quite a bit there to consider. And as we know, the records are not perfect, as in, I'm sure any clinician would be very careful to enter COVID vaccines into the right places, but still things get missed. And as you pointed out, Shane, in your data and Sam in mine, there are people with Pfizer that are more than 3 weeks overdue, but they could have had it elsewhere and they haven't been to this practice since whatever, a month or two. They might not come back for another 3 months, but what we don't know, like that would be, I guess, a starting point where you could check AIR or My Health Record and say, okay, yeah, they've had it. We can update it and they drop off our recall. It's still cumbersome. It's not great, but until, I don't know what the solution is, but it is fiddly to work with at the practice level, and it's a lot of admin time.
My favorite utopian practice manager story this week was a practice manager who said, but why can't the AIR records just be downloaded into our software? Great idea.
Yep.
Yes.
Imagine if that happened.
Well, AIR is opening up. That's going to get better. They've clearly seen that there is a need for that, so there might well be something that can happen automatically or semi-automatically or whatever.
Okay. So we've done the questions and comments. Okay, so the last thing, I'd just like to thank you again for coming along today. Don't forget the evaluation. It helps us to plan these things in the future. And also, if you do want some help, just email us at digitalhealth@cespan.com.au. All right. We're very keen to hear any ideas and any thoughts. Thank you very much.
Thank you very much.
Thank you, David.
Thanks, David.
Thanks, guys.
Cheers.